textbooks, dermatology, primary care. Throughout our lives, we will all interact with the healthcare system. So, what happens when that system is not designed with certain groups of people in mind? As a Black person in America, I have experienced firsthand racial disparities in healthcare. The turning point for me came during the pandemic when at a local clinic, I was asked if I had a red rash on my skin. At that point, it dawned on me that some healthcare professionals did not realize that skin rashes do not exhibit the same way on different skin pigmentations. If something so obvious could be so casually overlooked by a healthcare professional, what other elements of care, treatment, research, and education are also being ignored, and what does it mean for people of color using this healthcare system? I am Vivian Kobusingye Birchall, and in this series, we will take a closer look at racial disparities in healthcare, speaking with medical professionals, and hearing personal stories to get a better understanding of those disparities and explore ideas and strategies for how to bridge the gaps.
Hello, my name's Nalia Russell, and I am a nurse practitioner. I have a Doctor of Nursing practice degree from the University of Michigan Flint and am board certified as a family nurse practitioner. I've been a nurse practitioner since 2013, and before I became a dermatology nurse practitioner, I practiced in the primary care setting, seeing people all across the lifespan. So I did that from about 2013 till 2019, and in 2019, I was given the opportunity by a physician to train as a nurse practitioner who specializes in dermatology. That was a really wonderful opportunity, and it gave me a chance to really widen my field of practice. One thing that I will say about my experience with people of different skin tones in dermatology is that I quickly realized that what I learned in school in my nurse practitioner program was very limited in general regarding dermatology, but also very limited when it came to representation about different ethnicities and skin tones, and how really they do have different presentations on how maybe a skin disease will manifest, how it will look, how it can present. And this was really impactful to my practice. I started out practicing in Southern Maryland in a county where the majority of the population was Caucasian. And it was, really prevalent for us to see patients with skin cancers because there was a really high farmer population who had spent the majority of their life outside. A lot of them were elderly. And so skin cancer was something that I really quickly became comfortable with identifying and treating. And really, it wasn't until we opened a new office in a county that was about one county over where our practice kind of started to have this demographic shift. And I quickly realized that I was not as adept or skilled at assessing people who had skin of color. So my patient population made a large skew towards seeing an African American population when I had this practice in another county. And it was here that I realized that I just needed to kind of increase my skill set when it came to caring for patients who presented with different problems and also respond to treatments in a different way. So one of the things that I did was I signed up for training through the Skin of Color Society. And the Skin of Color Society is a professional organization that is geared towards providers who provide dermatological care. So mostly made up of physicians, but they also welcome members who are nurse practitioners or physician assistants. And just doing this simple, I think it was like a 4 or 5 part webinar series, was extremely impactful to my practice. As I mentioned previously, I would see a large Caucasian population who presented with complaints of skin cancers and such, whereas when I moved to that new practice, it was a lot of other things, a lot of scarring alopecias, which are actually quite prevalent in the African American female population, and just learning about those differences when it came to how African American hair differs from Caucasian hair. I mean, really at the microscopic level, looking at the differences between the structure of the hair and then therefore the complications that can occur in hair disorders in the African American population. So taking that webinar with the Skin of Color Society was extremely impactful. And I have to say it kind of, it definitely enhanced my knowledge, but it allowed me to feel more comfortable treating and engaging African American women when it came to hair disorders. I think we know that historically, women of color, African American women, have been discouraged from embracing their natural hair. There's been policies, there's been legislation, there are school dress codes that do not allow for natural hair, and it's not okay. So for women of color and African American women, what I found is that it can be kind of a difficult subject to broach because of the history of that discrimination against natural hair and that double standard when it comes to beauty about which type of hair is beautiful. The great thing is that we're seeing more and more women who are empowered and who are embracing their natural hair. And so my goal has been to learn what their natural hair, what are its strengths, what are its weaknesses, and how can I best help them when it comes to managing their hair. And it was definitely a learning curve, and it was nothing that we learned in school. And, again, I'm not a physician, so I didn't do a dermatology residency, but it certainly wasn't something that I was exposed to on the job training as well. So I really had to go out of my way to find training. And like I said, the Skin of Color Society was extremely helpful. So one thing I think is huge is the hair disorders. Another thing, of course, is pigment disorders. So with more melanated skin, there's risk for hyperpigmentation and things like that. So even with children who have eczema or women or males who suffer from acne, the risk of getting post-inflammatory hyperpigmentation is really high. And it can be psychologically distressing for patients. And so knowing the best way to manage that and treat that was something, again, that I had to really become more comfortable with. And knowing that, maybe we utilize Retin-A, but sometimes with people who have an even darker shade of skin, you have to be careful with the doses of Retin-A. You can't use as strong of a dose, and you have to be careful because then you might set off more of that inflammatory cascade and cause the more hyperpigmentation. So doing more harm than good. And also the treatments that I would offer to Caucasian patients who maybe had a benign growth like a seborrheic keratosis, which is just a type of basically growth that we see that is really common as you get older, so usually over the age of 40. A lot of people commonly call them moles or barnacles or age spots, anything like that. But, sometimes we can just really quickly spray those with liquid nitrogen in a Caucasian patient, whereas at the same time, if you did that to somebody who had more melanated skin, you might risk causing scarring or hyperpigmentation, which would be more distressing than the original disorder. So we just have to be mindful of the type of skin that we're working with in dermatology. We're equipped with things like the Fitzgerald Skin Scale, which helps us to assess a person's risk of skin cancer. You think about somebody like my husband who is Irish and Scottish, American, and a redhead. So, of course, he's like a Fitzgerald type 1 skin, really high risk for skin cancer. And then, we have all the way, go higher to lower risk with the more melanin that somebody has. But we really don't, I think that's also a disservice that we do because there's kind of this idea that African American people don't need to use sunscreen, which is simply not true. I mean, especially if they're suffering from pigmentary disorders, I mean, you really need to protect the skin from the sun so that you're not making that hyperpigmentation worse. Or are they using retinoids, things like that? Because then they're absolutely going to need to use sunscreen. And so just taking that that kind of like bias away from the providers, that's not necessary, and the bias away from the community is really important as far as education goes. Another thing to consider when it comes to skin tone is colorism, which is so prevalent in society. I think it's one of our implicit biases that we all have as people. Unfortunately, white has been kind of upheld as this standard of beauty, standard of purity, just the standard of power in the United States. And there's the darker somebody's skin is, the less likely, the more they may be discriminated against or judged. And that's not just with African American patients. I mean, the same thing happened in other countries as well. I mean, my father was born in India. My mother's Caucasian, but in India they have a caste system, and the color of people's skin can come into play there as well. So colorism is a big thing when it comes to discrimination. So just, I think, recognizing, because dermatology, is medical, but there's a lot of dermatology that has to do with aesthetics as well. And just recognizing that every color of skin is beautiful. There was that recent radio show host who was comparing women's skin color, African American women's skin color, to the degrees of how cooked toast was, and saying, he would date someone with a Halle Berry skin versus not somebody who had skin like Serena Williams. And that's just not acceptable. It's not okay. And so I think embracing beauty across color is so important, and something that we can validate in dermatology, but we have to know how to care for those patients. So again, you ask me about education. And my education did not prepare me at all to treat people who have skin of color. I look at my textbooks, and I'll send you some photos and everything, and I would say the majority of pictures for different disorders, dermatological disorders, are a rash or a lesion or something, and it is represented on somebody who has white skin. And that really is a disservice to the providers who are learning, because then we don't know how it would appear on someone who has darker skin, and we may not recognize it because it doesn't always look the same. It may not look red like we would see in the picture. It may be more dusky or dark in color. And there's, really subtle findings that we have to be aware of, and we have to look out for when we're assessing somebody who has darker skin and approaches us because perhaps they have a rash. So that's definitely one thing that I can say my curriculum did not prepare me for. And I know it is a wider conversation, especially in colleges of medicine, and I think in dermatology residency programs for physicians, they're making the case that this needs to change. So I'm hopeful that that's going to be something that we do see, but I think it's so important that we're even having this conversation. Another thing that I see with, skin of color, I mean, there's just disorders that impact people, I think, in different ways. I see a number of patients who suffer from vitiligo. And vitiligo is basically when there's a complete destruction of the melanin. So you lose the color of your skin. And of course, that is distressful to anyone that happens to. But it is especially distressful to somebody who has more melanin in their skin to begin with, because that stark contrast between the black and the white is so prominent. I mean, if you're somebody, again, like my husband, who is Fitzgerald type 1 skin, you can imagine, redheaded Irish person, if he were to get a patch of vitiligo where he loses his skin color, it would hardly be noticeable. Yes, he would probably notice it, but it would be completely different than somebody else who has darker skin and begins to suffer from vitiligo because the contrast is so stark. And vitiligo can be completely devastating, and it's more severe, when it's on the face and the head and the neck area. And it's so challenging to treat. I think of this patient that I actually just had within the last month, and he is an African American male. He suffers from vitiligo, and he has had vitiligo for the past decade. And it started out as one patch here and one patch there, and it has slowly spread to being over 50% of his body. And it keeps spreading. It's not like it's stopped at 50%. It's continuing. And he came to me and said, I want to get rid of all of my melanin. I just want my skin to match. And he tried to repigment the skin, which is very challenging. To actually bring color back is a lot harder than it is to lighten something. So, he tried the topical medications like topical steroids, anti-inflammatory antibiotics. He did phototherapy and things like that, and he had no success. So he got to the point where he thought for him it would be better to use medication that would basically completely bleach his skin and get rid of all of the melanin than it would to continue to be half black and half white. And it was really, it was devastating. It was heartbreaking to see the impact that was having on him psychologically. But I thought about, relatively new in dermatology. I've only been practicing dermatology for 2 years. And I said to him, well, I've never done this. I think it's, yes, it can be done. It is a treatment for vitiligo. But I want to look more into it. I want to speak with the physician that I work with and see what her thoughts are. Like, has she ever done this? Or maybe find you a vitiligo specialist. And we live near DC and Baltimore. So, maybe there's somebody at Johns Hopkins or George Washington University or Howard University that can help us with this. And he said, okay. He was fine with that. But I said, when he left, I just couldn't stop thinking about it. And I thought, to say to my medical assistant, the implications for doing that are huge, right? He's going to completely get rid of all of his melanin, which is protecting him, from the sun, and have to go to no melanin. So basically like albino, and completely increase his risk for getting skin cancers. He would have no tolerance for being out in the sun, essentially. And also, his personal identity as a black man. What would that mean for him to lose all of the color of his skin? And she agreed. We talked about it a little bit. He said his wife didn't want him to do it. She didn't think he should. And, I spoke with the physician I work with, and she's like, I've never done that treatment before either. Let's see if we can find him somewhere to refer him to. And so I did some research and I gave him some names, and he's going to continue to look into it. But I did tell him that I was concerned about the risk to him psychologically, what this would mean for him as a black male to lose all of his pigment and, his identity. How would that impact him? So I just wanted him to be really mindful of that. And the Skin of Color Society actually does have some really wonderful studies on the psychological impact of vitiligo for people of color. They have great articles on everything when it comes to treating people with skin of color. But he just made such a huge impact on me. And you really think about, identity and who somebody is. And I know we're more, obviously, than what we look like and all of that. But unfortunately, in our society, our race, it's a huge part of who we are. And it, for better or for worse. So I just worried about how he would respond, how that would impact him. So how can we improve all of this? I think it's incumbent on all of us who are providers or, people in general to be aware that there's these issues that exist. And if we're not getting the education that we need on our through our educational programs, to make a push for change in the curriculum. Our curriculum does need to be more representative. Our textbooks do need to include pictures of skin of color. And in the meantime, join a society like the Skin of Color Society so that you can be educated, so that you can have access to those research articles and those educational materials, and make a connection with your patients, because patients know if you're invested in taking care of them. And if maybe you don't have, you don't look the same as them, or you don't have the same issues as them, you can still you can still validate their experience by being prepared to take care of them, and by acknowledging when you don't know something or when you're learning about something. And that's what I've been trying to do, especially when the demographics of my patient population changed so significantly. I quickly realized how unprepared I was. And I just made a choice that I had to do better, because my patients are fantastic, they are wonderful, and they have unique needs, and I want them to be comfortable with me meeting their needs. So in general, we need to recruit more people who are from diverse backgrounds, who have diverse skin tones and diverse world views and experiences. And we need to make sure that they succeed, before they're even in college, so that they can get into programs to become providers. We need to recruit diverse people. We need to offer opportunities to not just physicians, but also advanced practice providers like myself, to nurse practitioners and physician assistants, to learn more about these disorders and also how it is different because of the amount of melanin in the skin. It does make a difference. Like I said, it makes a difference in some of the disorders, how they present, what it will look like, what the best treatment options are. And so it's just important that we all around increase the diversity within the workforce. As far as representation when it comes to clinical trials, in my experience, I absolutely acknowledge the historical challenges that we have had in the United States when it comes to the medical system, the way that people of color, especially Black Americans, have been exploited by the medical system. I mean, going back into, the 1800s with Dr. Sims and others who basically experimented on African American slaves to advance the field of gynecology, all the way into the 20th century with the Tuskegee syphilis studies, where they used African American men and denied them access to treatment for syphilis even though it was available. And so much systemic and historical racism has gone into the development of our medical system and what we know, what we've learned on the backs of African Americans. And so, yeah, I mean, is it surprising that they're not going to want to volunteer to be in research studies or to be trustful of the system? But I think as there's more discussion that this happened, that we own it, that we make reparations, that providers like me say, we want to do better. I want to understand your needs better. I recognize that I don't know it all, and I want to help, and I want to learn. I think people will feel more comfortable and hopefully will be able to be more representative in these studies. But as far as dermatological treatments and my personal experience, I cannot say that the lack of diversity in the clinical trials has made a large impact on my practice personally, but I mean, I'm sure that it has, when it comes to things like biologic medications to treat psoriasis and atopic dermatitis, the samples were disproportionately white, which is what we see historically. So absolutely, I mean, it's an issue. But I think that we have a lot of other issues, specifically in the dermatology field, that are not related specifically to the clinical trials. So as far as additional challenges, I think I spoke to a lot. I mean, like I said, acknowledging the systemic and historic racism that has existed, that has created barriers for populations, the lack of educational materials and time devoted to talking about skin of color, and also just like our own personal biases, and as a society, as a provider, as a community, we have to recognize that these things exist, that the standard of beauty doesn't include a lot of people who have skin of color. And in dermatology, which is a field that's more rapidly becoming known for its contribution to aesthetics, that's not okay, because every skin color is beautiful, and so and so is natural hair, and so I need to understand how to take care of that. So that's what I'm striving to do, and that's what I'm hoping to learn more about, and I really appreciate this conversation. So thank you so much.